Hello, everyone, and welcome to today's podcast titled Latino Patient Care. Culture has a major impact on how our society is molded today. It also has a major influence on how our healthcare systems function. My group and I have found special interest in how healthcare has adapted methods to adapt to Latino culture. We decided to specifically look at Latino culture in the Rio Grande Valley because it's such a big group of people that all our group members can relate to. When really looking into and analyzing the Latino culture in the Rio Grande Valley, we wanted to address the problem of not knowing how to provide care to Latino patients. So we came up with a research question. That research question is, what do hospitals in the Rio Grande Valley do to incorporate methods to provide care for Latino patients? So by looking at how hospitals in the Rio Grande Valley provide care to their patients, we can analyze them and study and probably figure out a way to um, incorporate better methods or new methods or just branch off of those methods that are already in use. Learning the methods that healthcare systems have created to help Latino patients is important because Latinos are a major minority, and if there wasn't any proper methods put in place to help give them the best possible healthcare, there could be more lives lost and or people receiving improper healthcare. Ultimately, a major concern is finding the best ways to provide the best healthcare to Latino patients. From our experiences as volunteering at hospitals, having medical professionals as our parents, and being Latino patients ourselves, we hypothesize that some major methods used are hiring a diverse staff, implementing trainings on different cultures, creating surveys for patients to fill out, and having translators at hand are some of the major methods used in healthcare systems today. There are most likely more methods that we don't know of, and potentially some that are more effective, but by hopefully doing further research and analyzation, we will find the best ways to provide healthcare to Latinos. To help grasp a better picture of how hospitals incorporate methods, we would like to present to you with four different sources. Our first source comes from Chapter 7, Racial and Ethnic Disparities in Healthcare, written by Joseph R. Bentoncourt and Alexander R. Green. The major situation that they face is that they need to figure out a way to provide care to different ethnic groups. In their claims, they suggest that healthcare places collect data on diverse patients so that they have it for future reference. They also have staff trained in different cultures. They hire more staff, like a diverse staff, and have patient interventions. The authors don't really conduct their own research, but they take from their own personal experience as medical doctors and analyze different sources. They focus on trying to get the attention of medical professionals and provide possibilities to improve healthcare for different ethnic groups. Their claim is pretty similar to our own hypothesis. It appears like their methods are reasonable, but there are more to just than those methods. The second source, coming from chapter 37, Cultural Competence by German E. Jezi, Sahari, Rodriguez Perez, and Efren Marjuanes. The situation that they try to address is that cultural diversity has increased tremendously in the United States, and there needs to be a way to provide health care to diverse groups of people. To help face that problem, they suggest conducting assessments on medical staff to test their knowledge on diverse cultures so that proper training can occur, and create a curriculum to teach medical staff. Also, by taking surveys on patients, monitoring how well patient care was provided for those diverse groups of people. They also suggest that a diverse staff should be hired. Through their research and analyzation of other sources and their opinions on what they think is best based on their experience in the medical field as doctors. They focus on giving suggestions to medical professionals on how to provide better care for diverse populations. They provide very little on methods, but what is provided seems reasonable. They don't look at methods for Latino patients, and they are lacking when it comes to providing their own research. Third source, how can healthcare organizations implement patient centered care? Examining a large scale cultural transformation by Barbara G. Bakor, Jimeni M. Fix, Nora M. Weller, Anna M. Barker, Sherry L. Lavelli, Jennifer N. Hill, Jeffrey L. Solomon, and Carol Van Dusen Lax. They feel that little is known about how to provide the best care to different cultures, and they claim that healthcare systems need to focus on providing the best care for individual patients. To help figure out a way to solve their problem, they interviewed a staff at a veteran hospital and how patient care was provided to those diverse patients. Their purpose is to help medical staff provide better methods of health care to diverse patients. They also provide very little on methods, but what is provided seems pretty reasonable. There are missing methods of providing care to Latino patients, and they conduct their own research, which is a more valuable and meaningful research than not having their own research. The fourth and final source that we looked at was educating medical professionals to deliver quality healthcare to diverse patient populations by Marcus L. Martin, Sherry L. Heron, Lisa Moreno Walton, Leslie Oldine Walker, and Anna Walker Jones. Their situation was that medical professionals need to be trained on how to provide the best care for diverse patients. So they claim that hospitals need to integrate training for medical staff about providing care for diverse groups. Their research was that they reviewed other sources and used their knowledge from their experience in the medical field. Their ultimate purpose is to persuade healthcare places to integrate training programs to teach staff about care for diverse patients. When analyzing our sources, we found that a major gap was at display is which that they didn't look at the Rio Grande Valley hospitals that provided care to Latino patients. To help fill in that gap, we decided to conduct an interview. We conducted an interview with a nurse that works at a hospital in the Rio Grande Valley region by the name of Mr. Jacobs. He is a perfect candidate to interview because he works for a hospital in the Rio Grande Valley called Harlingen Medical Center, and he has experience providing care to Latino patients. To help protect him, we asked if it was okay to record and use his responses for our research, in which he kindly allowed us to do so. The way we set out to conduct our interview was by setting up a list of 15 questions that we believed would help us answer our research question, and recorded Mr. Jacob's responses to them. The questions that we asked were, what do you do if you don't know what a patient is saying? How do translators help when dealing with Latino patients? How many staff members attend to one Latino patient? How does your staff prepare to provide care to Latino patients? How do you prepare to provide care to Latino patients? What are problems when dealing with Latino patients? How do you deal with the problems with your Latino patients? How do you present yourself to a Latino patient? How do you introduce yourself to a Latino patient? In your experience, how do Latino and American health problems differ? What do you do differently with Latino patients from American patients? What other complications do you face with Latino patients not mentioned earlier? They all pertain to how Mr. Jacob provides care to Latino patients so that we could just figure out the different methods. The results we got were pretty short and to the point. In the first question that we asked, what do you do if you don't know what the patient is saying? He responded with that they use translation devices the hospital provides for the staff in the occurrence of a patient being of Latino culture and only speaking a language foreign from English. He skipped the next question, saying that he answered it with the previous question. The next question that he did answer was, how many staff members attend to one Latino patient? In which he responded with, it depends on the severity of the patient and multiple factors like weight. Um, the next two questions he avoided saying that he responded to them in the last question. The next question that he answered was, what are problems when dealing with Latino patients? He responded with, it varies dependent on the patient, such as language and religious barriers being present. The next one he answered was, how do you deal with the patient's problems? He says it depends on for example, a Jehovah Witness patient, they receive an alternative for blood that they are willing to accept. The next question he answered was, how do you present yourself to a Latino patient? He said that he introduces himself with his name and title. He skipped the next question, saying that it was the same as the previous question. The next question he answered was, in your experience, how do Latino and American health problems differ? He said that Latino patients have a higher percentage of diabetes, while American patients also have a high percentile. It's just more prominent in the Latino culture. The next question he answered was, what do you do differently with Latino patients from American patients? He says that he doesn't really try to do anything differently. The next question was, what other complications do you face with Latino patients not mentioned earlier? He says, nothing. I try to treat everyone equally and believe everyone should be treated equally. Some other important quotes that came up were, with patients that are bilingual, we usually speak Spanish or English down here, the language that the patients are comfortable with, and with patients of other languages, we have an intercepting machine for the hospital. Basically, it's like an iPad that we can choose a language and interpret what comes up on the screen. Another quote was, the level of care affects how much staff cares for a patient. The next quote is, language and religious barriers are the major factors that affect patient care, but like with Jehovah's Witnesses, they don't accept blood, but there are other alternatives. The next quote is, the Hispanic population has a very high percentile of diabetes. The next quote is, I try not to do anything differently. I try to treat everyone equally. The next quote is, ideally, nobody should be treated differently. Everyone should be treated equally. And the last quote is, so culturally, in the Hispanic culture, we have a grandma's remedies for everything. Vicks, cone, the huevo, the teas. Often, before they come in, they try the alternative stuff that abuelas say will fix everything. When analyzing the data, we saw that there was a lot of repetition of him saying, we try not to treat anybody differently, and that he keeps his responses pretty short. We believe the way in which he responded shows hesitation to answer the questions, or that he wasn't focused on the interview entirely. We also believe that the data shows that he could have been scared of answering, so by answering with basic responses and responses that don't draw racism and focus on equality, keep him safe. Which unfortunately for us doesn't really give us the answers that we were quite looking for, but we also noticed with his responses there was a significant difference with his initial and last responses compared to the responses in between. He started and ended by giving a lot of more information, but in between he started shortening and making his answers basic. Throughout our journey of trying to find the answers to our research question, we had major struggles and unexpected obstacles leading us to answer our research question, what do you do hospitals in the Rio Grande Valley do to incorporate methods to provide health care for Latino patients with a similar response as our hypothesis of hiring a diverse staff, treating Latinos equally to other patients, but personalizing their care due to certain circumstances, implementing trainings on different cultures, creating surveys for patients to fill out, and having translators like technologies that deal with translating at hand um, are some of the major methods used in healthcare systems. Knowing that our research falls short and doesn't have all the answers, we want medical professionals to rise up and help find out the methods of providing care to Latino patients and or creating new and even better methods that will help better care for Latino patients. This concludes our podcast and thank you all for listening.